Hi, I'm Dr. Sarah Pederson, an OBGYN and founder of Vera Health and Fertility, where we take a personalized, holistic approach to hormone balance and fertility. Today we're going to talk about how do I know if I have PCOS. PCOS stands for polycystic ovarian syndrome. And one thing that's important to know is that there is actually a lot of different types of PCOS. I feel like a lot of times women get this diagnosis of PCOS and they kind of all get lumped into this one thing. So if you've ever been told that you have PCOS or you're worried, you should definitely have an evaluation because there are different types of symptoms that women have. Not all women have the same thing. For example, the traditional diagnostic criteria for PCOS comes from something called the Rotterdam criteria, which is basically saying that you have to have 2 of 3 criteria. One is that you have to have irregular cycles, or what we call anovulatory cycles, meaning you're not ovulating or you're not ovulating most of the time. The second is if you have polycystic looking ovaries on an ultrasound. And the third is if you have hyperandrogenism. So we'll kind of break those down. So the first is if you have irregular cycles. So if you have a cycle greater than 35 days, or you have fewer than 8 cycles a year, or you go for months without having a cycle at all, you're probably not ovulating. That's considered irregular cycles or anovulation. So that's part of the criteria. The second one is ultrasound. So technically, if you have greater than 20 follicles per ovary, or your ovaries are enlarged on ultrasound, so technically greater than 10 cubic centimeters on ultrasound, then that's part of the criteria of PCOS. One thing that I think is kind of confusing is that we call it polycystic ovary syndrome, but what we really should call it is almost like polyfollicular ovary syndrome. Not that you have a ton of cysts per se on each ovary, but that you have a ton of little tiny follicles all over your ovaries. So that we can see on an ultrasound, that's part of the criteria. The third is hyperandrogenism, meaning you have excess androgens. Usually that's measured from a blood test for testosterone and something called DHEAS, which comes from your adrenal glands. And the manifestations of that are that you can have hair growth in abnormal places, or acne, or male pattern hair loss. So kind of signs that you have a little bit too much testosterone on board. So if you have 2 or 3 out of those criteria, it's technically the medical definition of PCOS. However, there's a lot of other things that women with PCOS tend to have. For example, an elevated AMH, or anti-Müllerian hormone, which we sometimes consider as the ovarian reserve test or the egg quality test, or if you have insulin resistance, like an elevated hemoglobin A1C, or an elevated fasting insulin, or you have trouble losing weight, or you have obesity. Those are all kind of in the spectrum that you could have that are associated with PCOS. The other one that you might see is an elevated LH to FSH ratio. So when you get your hormones measured, sometimes your ratios can be off, and that can point toward PCOS. But I think the bottom line to know is that PCOS comes in a lot of different ways. Some people have irregular cycles, some people don't. Some people have enlarged ovaries, some people don't. Some people have trouble losing weight, some people don't. Some people have insulin resistance. So it's really important to get really thorough blood work and a really thorough ultrasound, and really work with your doctor to see like what type of PCOS do I have and how that's affecting my life. If you have any questions, you want to get evaluated, come check us out at Vera Health and Fertility, verafertility.com.